Newfoundland and Labrador are among the leaders in Canada for developing the electronic health record. The electronic health record is a system that brings together information from multiple points in the healthcare system. Essentially, the electronic health record provides more comprehensive information to healthcare providers so that they can provide higher quality care to those that present for services.
Having one source of information like the HEALTHe NL viewer is certainly important. Having to go to 2 or 3 different sources to find bits of information decreases our efficiencies. Not having everything on the screen at the same time can increase, the possibility that we'd actually forget what was on another screen from another jurisdiction or another source. So it does ease and increase the accuracy of the information that we use.
Having access to the pharmacy network improves patient safety and care because it offers clinicians, pharmacists, nurses, and doctors the ability to see a full profile of the medications that a patient is on. In addition to that, it allows same clinicians to see such things as drug allergies and important clinical notes that other clinicians have provided on there.
One of the things that the viewer will provide, and I think in creating efficiencies for practice in long-term care, community, or even within the hospital environment, is your ability to customize patient lists. As an example, influenza season is coming, so we can set up a list of individuals that need to have their influenza shots, so that way patients can be notified, come in and get their influenza vaccine. We can also do it around patients who have varying chronic diseases. Again, if you have a client list of people who have diabetes, we're able to do the correct follow-up in a timely manner, which hopefully improves care, improves outcomes, and ensures, patient safety.
The ultimate benefit of an electronic health record is the provision of more timely and more complete information for providing patient care. The other major benefit of the electronic health record is that it could actually contribute to reducing costs associated with healthcare delivery through the reduction of duplicate testing that occurs right now around the province.
Having all this information will be very, very important. From a pharmacy standpoint, having access to lab values is paramount. There are medications that doses need to be adjusted based on certain lab values. In the future, through the pharmacy network and HEALTHe NL viewer and electronic health records in this province, we will have access to that.
The privacy of the viewer is probably a little better than you would find in a regular paper chart. A regular paper chart can be picked up and gone through by a provider, whereas access to the viewer, you have to have a code in order to get into it. The public, I think, can be reassured that they will know that their information will remain private just to those individuals that need it.
Every provider in our province, and ultimately in our country, and every patient in our province will have their medical history available wherever they are, and have accurate, secure, and inclusive, comprehensive information available at all times.
For new patients entering a practice, I think the viewer will be invaluable. I don't need to go and search through archives in order to get information on patients. It will be available to me electronically, both from specialist consults, diagnostics, referrals to other healthcare providers. So you get a full, you get the full meal deal, if you will, at the click of a button.
As far as the patient's standpoint, it really benefits them. A, first of all, because it reduces wait times for them, and B, it's a lot safer. Whether they realize it or not, it takes a lot of the guesswork out of trying to figure out, okay, is this all the medications that they're on? We have access to see that information with the pharmacy network. It's all there in one spot. So we're able to make better clinical decisions based on the information that we have.
HEALTHe NL makes patient care safer by having all of this information follow a patient wherever they are in our healthcare system, so that their providers can quickly and easily look up the information that they need so that when they're making their decisions, they have that information available to them.
The biggest benefit to providers is more complete and timely information when they're treating patients. More information would insinuate better level of health care. From a patient's perspective, this more comprehensive information equates to one thing: patient safety.